Well, good afternoon. Thank you, everybody, for joining us today. My name is Katie Baker, and I am the Virginia State Director for Protect Our Care. We are a national advocacy organization whose mission is to strengthen and protect healthcare, and we do so largely through events like this one, where we engage with and inform the public and the press. Much of our work for the last 8 months or so, in fact, almost exclusively so, has been focused on fighting the biggest cuts to Medicaid in history that were contained as part of what we call the Big Ugly Bill that Congress passed and that the president signed into law on July 4th. These cuts are going to put our rural hospitals at particular risk, both to the number of people who are going to end up losing their health care as a result, and due to restrictions on what's called the provider tax, which is basically going to mean hospitals are getting less money back in their Medicaid reimbursements. The good news is that it is not too late for Congress to reverse course and restore this funding. The cuts have not gone into effect yet. So we have launched a tour to draw particular attention to what the impact is going to be on our rural hospitals and our rural communities. We've done events in Richmond, Roanoke, Charlottesville, and we're excited to be able to add a stop to this tour in Tazewell. And we have been joined by champions like Congresswoman McClellan here from Richmond, who kicked off the tour with us in Richmond. And I think she said yes to every single event that we've asked her to do with us because she's such a healthcare champion in Congress. And we've also been joined by great partners, including SEIU, Planned Parenthood, Sarah of Virginia, and a special shout out to the Committee to Protect Healthcare, which is an advocacy organization made up of doctors who really want to be voices for their patients. And we have a couple of those doctors here who are going to speak today. Rural hospitals, again, are particularly at risk, including one here in Tazewell that has been identified as one of 6 that's actually at particular risk of closure. So we're really hoping that we can spread the word and create some more pressure on Congress and get them to restore that funding. And just so honored to be joined here by Congresswoman Jennifer McClellan. And with no further ado, I'll let her take the mic. Congresswoman.
Thank you. Thank you. Thank you, everyone. So you're probably wondering why a member of Congress from Richmond is here in Tazewell today. But in addition to representing Richmond, my district, Virginia's 4th district, includes from Charles City County down to the North Carolina border. So I have a number of rural localities, and I have one of the 6 Virginia hospitals at risk of closing in my district down in Emporia. But I also sit on the Energy and Commerce Committee in the House, which is the committee that deals with health care, which is the committee that had a 6.5-hour hearing on this bill where I joined my fellow Democrats to fight back against these Medicaid cuts. And I spent almost 18 years in the Virginia legislature, including being in the state Senate when we expanded Medicaid. And we did that on a bipartisan basis. And it was a particular coalition that included Republicans in rural areas who understood the importance of expanding Medicaid to close the gap of who had health insurance. And because when you don't have health insurance, you still get sick. You still go to the doctor, but oftentimes you don't get your primary care. You're showing up in the emergency room when the cost of care is much higher. That care is going to be compensated, and then the rest of us pay for it through either higher health care costs that we pay or higher insurance premiums for those of us who are insured. And so from all of those perspectives, having been a patient, having been a family member of a patient, I understand how critically important our healthcare safety net is. And so I'm, in addition to joining Protect Our Care, I have been traveling around, particularly rural areas, to see firsthand the impact that these Medicaid cuts are going to have on our rural communities and sound the alarm. So this morning I was in Abingdon visiting a dental clinic where over 80% of their patients are on Medicaid. I have in my district a long-term care facility where 90% of their patients are on Medicaid and the other 10% are on Medicare. And I'm here to say, first of all, this big ugly bill that was signed on July 4th is not only the largest cuts to Medicaid in American history, but according to the Congressional Budget Office, is estimated to kick 17 million Americans off their health insurance. And that is through two ways. First, the cuts to Medicaid and the changes to Medicaid eligibility that require onerous paperwork for many people to prove they're working. And we've seen in states that have adopted those requirements that even people who were working, who were eligible, or fit one of the exemptions still got kicked off of their health insurance. But the bill, because it adds $4 trillion to the national debt, triggers cuts to Medicare that will cut critically important services to our seniors. And because it does not extend the tax credits for people who buy insurance under the exchanges, that's how they get to that large number. It'll be hundreds of thousands of Virginians. And again, they're still going to get sick. And they're going to show up in our emergency rooms when the cost of their care is much higher. It is going to affect our hospitals. And just to pick up on something Katie said about the provider tax is how states pay their share of Medicaid, because Medicaid is a federal state program. And our providers, they were willing to pay that provider tax. And yet this bill will limit how much of a provider tax states can impose, doesn't tie it to inflation. And as you know, the cost of everything is going up, including their cost to provide care. And yet by handcuffing the state in its ability to pay its share, while then blowing a hole in the state budget through these cuts to Medicaid, through cuts to the SNAP program, by shifting more costs of education and many other issues back to the states, the General Assembly and the next governor are going to have to make some really difficult decisions about whether they raise taxes or what services they're going to cut. Our local governments are going to have to make those really tough decisions too. But more importantly, what I am seeing is whether it's in Waverly or Emporia or Tazewell or Abingdon, places that already were healthcare deserts could lose the only providers that are there, because without Medicaid and the funding they receive, they just can't afford to provide the care. And you would have more insured people who, when they do find care and have to drive even farther to get it, they still won't be able to afford it. So we're sounding the alarm. It is not too late to turn this around. Senator Josh Hawley, a Republican, has filed a bill shortly after he voted for Medicaid cuts. He filed a bill to reverse them. I am co-sponsoring a bill in the House to reverse these Medicaid cuts. And while they don't take effect until January 2027, as I mentioned, the state's going to have to make decisions right now about how to reflect these cuts in their state budget. And we're already seeing providers around the country, including one in Nebraska, that are either closing or about to close their doors, and specifically say it's because of these Medicaid cuts. So I want to thank you for being here. I hope you help spread the word about how we need Congress to act now to extend the tax cuts for people to buy under the exchange, which, if Congress doesn't act, will expire at the end of this year. That we need to make sure that Congress reverses these Medicaid cuts and do what we can to ensure that every Virginian, and I'm doing everything that I can to ensure, not just every Virginian, but every American, regardless of your zip code, regardless of who you voted for, regardless of where you live, that when you need care, that care is there, it's quality care, and it's affordable. So thank you all for coming out today.
Thank you so much, Congresswoman. Thank you for all you do. And I think it was right after that 26-hour hearing that you did in the Energy and Commerce Committee, you hopped on a Zoom press conference with us to debrief press and let them know how that went. I think you'd been maybe up for like 40 straight hours at that point. So I have not done that since college, so I just really admire your willingness to be out there fighting for the people just nonstop, literally without rest. Unfortunately, like, not everybody in Congress has been a champion and a fighter. The member of Congress who represents this district did vote for the cuts. Somebody just sent me a news clip back from June in which he actually expressed concern on TV that the changes to the provider tax could devastate rural hospitals. So again, it's not too late to reverse course, to follow the example of Senator Hawley, even though he voted for the bill, who's realizing, oh, this is actually going to hurt our rural hospitals in our state, and maybe we need to reverse course here for the people that we represent. Next, I want to introduce one of our doctors from rural Virginia. Again, Committee to Protect Healthcare has just been an incredible partner. Every single event we've done, they've been able to find area doctors to come out and be voices for their patients and their communities. So next will be Dr. David Mitchell, doctor.
Hello, everyone. I'm Dr. David Mitchell. I am a board-certified internal medicine doctor, and I've worked for about 25 years in hospitals. I moved to Southwest Virginia in 2016 and have worked at Russell County Hospital in Russell County, Norton Community Hospital in Wise County, and Abingdon Johnston Memorial in Washington County. As a hospital doctor, I know how important health is for everyone because I see people in the sickest part of their lives and struggling with health problems, and health is really the fundamental foundation of a productive life. So personally, I believe that great countries invest in the health of their citizens, and that as a high priority, because productive citizens make a productive country. So that investment pays off multiple fold if we do it. As a doctor, I can also tell you that no one wants to be sick. Nobody's seeking to be sick or be in the hospital. These are people often fear being sick and disabled, and so Medicaid has been a lifeline for those people who cannot afford health care or fear not being able to pay for the health care that they need. And these are health services that board-certified doctors deem appropriate and necessary for these patients. It's not unnecessary care. But based on all estimates, the changes to Medicaid that are rolling out in the coming months will cut off health care for many eligible patients. And so these patients will delay care, important medical care. They will stop taking medications that they can't afford, for example. Their medical conditions will worsen, possibly become life-threatening. They will also have an additional fear of potential high medical bills that they simply cannot afford. We shouldn't have these worries in a country as wealthy as our own. However, we will not save money as a nation, not a penny. We'll actually lose money because these same patients will come in sicker with more complex and expensive care required. On top of that, rural hospitals like Russell County and Tazewell Community Hospital may crumble. I know ever since I've been at Russell County, they've been worried about barely making it. So this is not a help. As a doctor who has worked years at Russell County Hospital in particular, I know how integral that hospital is to the community and the surrounding communities. It's a major employer, which subsequently supports other employers in the area. Also, the employees of Russell County are really like a family. They know their patients. The patients are their neighbors and their friends. I'm sure the same is true in Tazewell. Losing these hospitals for those communities would be tragic in many ways, but also dangerous to the health of those citizens that need access. So as a doctor, for me, it's really shocking that Republican politicians in Virginia can vocally and even enthusiastically support the changes that are being made, because in the months to come, the impact, I think, will be undeniable on the citizens of Virginia and the viability of our healthcare systems. So, I would just say, since I've been in Southwest Virginia, I've met many, many very hardworking people. Loggers, farmers, ranchers, miners, concrete workers, house cleaners, child caregivers, all kinds of real work, hard work, work that's hard on your body, work that a Wall Street executive or a lieutenant governor wouldn't last a day at, Probably I wouldn't last a day at. But unfortunately, we have to accept that despite this hard work, a lot of, in our society, we don't often pay a fair living wage to people that do this hard work, and it doesn't cover the high cost of health care for a lot of them. On top of that, that hard work wears down a body, and a lot of these patients I see have worked very hard physical jobs all their life, and as they've developed chronic progressive diseases, they can't do what they're trained to do. They can't do what they're professionally able to do. So these are points in life that become a barrier, and we shouldn't, as a nation, abandon these individuals, of course, in their time of need. They don't have the luxury of sitting in a comfortable, climate-controlled office every day as they do their job. They're out in the heat, the rain, the snow, and the ice doing their work. So sadly, many of our leaders want to give tax cuts to the richest of the rich, at the same time setting up barriers to people who are trying to get just basic, appropriate health care. So as a doctor, I believe we need leaders who will fight for health care in Virginia. We should all be standing up and demanding these Medicaid changes be reversed before our Southwest Virginia communities lose the care they depend on. And thank you, Congresswoman McClellan, for helping lead the charge on this important issue. Thank you all.
Thank you so much, Doctor. And you said a couple things that made me think about a couple other points I wanted to make. One is that KFF, which is formerly the Kaiser Family Foundation, did an analysis of this bill, and it found that its impact in terms of the decrease in Medicaid spending over the next decade is going to impact rural areas in Virginia more than rural areas in any other state, with the exception of Kentucky and North Carolina. So it's going to hit states that have a lot of big rural populations who rely on Medicaid, and those states that have expanded Medicaid, as we did here in Virginia, as Congresswoman McClellan spoke to. And the other was, and Dr. Mitchell alluded to it, but we have a Lieutenant Governor, Winsome Earl-Sears, who has been asked by reporters, what do you think about how these Medicaid cuts are going to impact our rural hospitals? And she said, well, I just say don't panic. And then didn't really have much of a response or a plan, beyond, simply saying that. And at another occasion was asked, are you concerned about how these Medicaid cuts are going to, result in Virginians losing their health care? And then made a vague statement about, well, we've got this rainy day fund. But mathematically, that would only be a drop in the bucket, even if we use the entire rainy day fund to put toward the money that's going to be lost in Medicaid cuts. And then we would lose the rainy day fund, which is supposed to, support things like education and other things that we need for a literal rainy day and not one that Congress created. And so next, I'm excited to introduce my friend from SARA of Virginia, which is a substance use disorder advocacy organization. They've had representatives join us at almost every stop, and Jason drove up today, I believe, from Bristol. So excited to have his voice here. Jason.
Thank you all for inviting me to speak today. My name is Jason Pritchard, and I live down the road in Bristol, and I have the honor of serving as the board president for SARA of Virginia. We are an education and advocacy organization whose mission is to transform communities through hope, education, and advocacy for addiction prevention, treatment, and recovery. We are here because the cuts to Medicaid threaten SARA's mission in the communities all across the Commonwealth, including here in Tazewell. Medicaid is one of the most important tools in our country to help fight the opioid epidemic. The difference between staying in recovery and relapsing is often determined by whether or not someone has the insurance to afford the treatment. Take it from me. I'm a person in long-term recovery, having recently celebrated 13 years in recovery. In 1998, I was involved in 2 very serious car wrecks. which led me on a road to pain medications. And then I endured 16 years suffering from co-occurring disorder of substance use and depression. For part of my recovery, I had insurance through the UVA health system. So I had insurance through the UVA health system since I was a student, but upon graduation, I was kicked out of the university's health system. So what used to be a $50 monthly cost for medication immediately became $460 a month. So I relapsed shortly after losing my insurance coverage. Over 36,000 Virginians and 26,000 West Virginians right now rely on Medicaid to cover medication-assisted treatment to treat their substance use. MAT is considered the gold standard for treatment, and they go to hospitals like the one here in Tazewell, which provides addiction services. The historic cuts to Medicaid that Congress passed last month mean people currently in recovery thanks to Medicaid may be at risk of relapsing if they cannot continue their care. It also threatens the rural hospitals, such as the one here in Tazewell. When rural health facilities close, fewer people can achieve and stay in recovery. And let me tell you, if someone is experiencing an overdose, the difference between life and death may literally be how quickly they can get to a hospital. So Sarah of Virginia is calling on Congress to immediately reverse course and restore funding to Medicaid, because I'm worried about what the obituary page in our rural communities is going to start looking like if we don't. Thank you.
Thank you so much, Jason, for those very powerful remarks. I'm just so excited to have you at another one of our events. And next we'll have another doctor from our partner, the Committee to Protect Healthcare, Dr. Bickley Craven. Doctor. Woo!
Well, as she said, my name is Bickley Craven. I'm a family physician and live in Abingdon. I am proud to be an advocate for the community to protect health care. I've served the people of Southwest Virginia and the region for over 35 years as a family physician. The entire time I've served in what's considered medically underserved areas. In Southwest Virginia, that may be that there's not enough services, not enough docs, not enough nurse practitioners, etc. But a big reason for folks to be underserved is their lack of access to services because they lack health insurance. Medicaid, of course, is a very important source for that health insurance for rural Virginians. Most people who have Medicaid do work. Unfortunately, healthcare is expensive. Alternatives to Medicaid coverage are expensive and are not available to many. They're just not affordable. Many folks who lack insurance delay the care because of the large bills that come from that. They delay care in such as seeing the doctor, taking their meds, accessing preventive measures, which can actually prevent, save lives and decrease people's suffering, or seeking care in an emergency, and all these things can have dire consequences. Some of our family, friends, and community will become sicker and even die prematurely when this health care is delayed. President Trump, the Republicans in Congress, and with the support of politicians like our Lieutenant Governor, have passed a bill that cuts Medicaid funding severely, which you know. It means that across our region and nation, that many will lose this coverage and therefore lose access to appropriate, timely health care. A few years ago, I took care of 5 different women during about a year's span that all had cancer of the uterus. All of these women were uninsured and lacked health care coverage and access. All delayed seeking medical attention in spite of having obvious symptoms. When these symptoms of this particular cancer are seen early and the disease is diagnosed and treated early, you can have very good outcomes. Unfortunately, if not, then you often have death, which could be avoided. And unfortunately, some of these women suffered that problem, and it was all because that they had no health insurance and delayed seeking care. They didn't want to put the burden of the expense on their family. The cuts in Medicaid funding planned by the Republicans will cause that scenario to be repeated, as you can imagine. Hospitals will pay the price. They provide uncompensated care now, but of course it'll be even more when you cut a lot of the folks that are paid for through Medicaid. The reckless cuts from the Republicans and President Trump threaten, as we've heard, 6 different rural hospitals, including Tazewell Community. When the hospitals close, the community suffers, and of course individuals suffer, but the economy of the community suffers significantly. When I was in practice in Lee County, it was the second largest employer in the county, and that was I think the school system was the number one employer, and it's often the first or second largest employer in our rural communities. So you can imagine the effect of losing those jobs, and the economic hit that the community takes. But also, then people suffer emergencies. You have asthmatic emergencies, people with heart attacks and strokes, people with severe bleeding, pregnant women even in labor, and others will see a delay in their care, primarily for distance. All these will be at risk of severe consequences and complications. So the deep cuts to Medicaid passed by Trump and other Republicans and supported by Lieutenant Governor Earl Sears will take away health care from our fellow citizens and greatly stress rural economies. These cuts that have been passed, as you may know, are going to help free up some money to give or continue huge tax cuts for wealthy individuals and for large corporations. Virginians are concerned, and Lieutenant Governor Earl Sears says don't panic, but presents no plan for how we can affect that or how we can avoid, how we could handle these steep cuts in Medicaid. So we Virginians, especially in southwest of Virginia, deserve leadership that'll stand up for our health care, not stand by while it is stripped away.
Thank you so much, Doctor. Just really appreciate your remarks. And, as you were talking about the folks who are on Medicaid who are working, most of those folks in the Medicaid expansion population, who are the ones who are going to be most impacted by this bill, are working. And, in addition to the new, burdensome requirements that are going to result in people not getting their paperwork in on time and losing health care, the bill also, or law now, also raises costs on them by introducing new $35 copays on certain services. And, if I get a copay for $35, I'm like, oh, that's a lot. But just imagine if you're on Medicaid and you're in a low wage job, like that's going to hurt. And that absolutely could discourage people from going to that doctor if they don't have that $35 to make the copay for the health care that they need. And next, happy to introduce a local community here from Tazewell. Martha Wahlberg, did you want to say a couple words?
I don't have anything I don't have a personal experience with Medicaid. So I just wanted to, but depending on the local hospital, that's kind of nice because that's right there and right down the road. So that's a huge plus. I had breast cancer in 2000, and so, getting a mammogram, it's really convenient to be able to go there and get a mammogram, as opposed to 40 minutes that way, 45 minutes this way, that kind of thing. So that's good. And then, well, the cost of healthcare is obscene. And I don't know. I'm kind of in the middle. I feel fortunate in that I have Medicare, and I have a supplement, but I don't know that I think I can afford the supplement for that long, so I've got to find something else there. And the idea of the fact of not going to the doctor when something's wrong, if it's going to cost, affects everybody. Of course, there are some people that have, top-notch health care, I guess, insurance. So what do they care? But and overall, it seems like there's this denigrating people that can't afford. So underneath all of this is the fact that people don't deserve health care, or they're not working hard enough, or they're not sick enough. It's like, I don't know. So there's that. But anyway, that's all.
Thank you, Martha. And I just wanted to build on something you said about just like easy access to get a mammogram at the local hospital here. and what happens when convenience is taken away from people. And barriers can come in a lot of forms. They can be money. They can be $35 copays. Dr. Craven spoke to these women who didn't want to be a financial burden on their families, so delayed care in some cases until it was too late. It can be distance. It can be, if there's not a local hospital and you have to drive an hour or more to get to a hospital, you have to budget that into your day. And we were talking earlier, and a doctor's visit could end up being your whole day, when you factor in the travel and the waiting in the waiting room. And it can just be convenience and time more generally. And I don't often share my own personal stories at these events, but I was thinking of my own when we spoke earlier. So I'm 42, and you're supposed to get your first mammogram when you're 40. And I had one scheduled for my first mammogram when I was 40. But I'm somebody who's always going to put, my work first and myself and my health second, and got caught up with a work obligation. Of course, it was myself who was putting that pressure on myself, not my clients. But I ended up missing the appointment, and I just didn't get it rescheduled. And then earlier this year, it was just a few months ago, I was invited to go to a healthcare fair down in Hampton Roads at the invitation of one of our partners, wearing my, just in my professional capacity representing Protect Our Care. So of course I was like, oh yeah, of course I'll go. I want to be a good partner. I want to check out your health fair. And so I went down there, and they actually had a van where you didn't have to have an appointment. You could just go in to get a mammogram. And I was like, oh, that's really easy, and I don't have to do anything. All I have to do is walk into this van and get my first mammogram. So I did, and it was super easy, and I did it, and I was very lucky. The results were normal. But I think about, what if they hadn't been, because I waited another 2 years because I just, get too caught up in work and things aren't convenient. And I really have no excuse since I live outside of Richmond, to get health care. But, that's just example of a barrier that even I, as a healthcare advocate, confronted. And I realized I delayed my own preventative care. So, people are absolutely going to end up falling off because of the barriers that this legislation is placing on people.
Can I add one other thing?
Yeah, of course.
Since Katie brought up the copay, and I want to put some numbers to this. So I want you to think about, to be eligible for Medicaid expansion, these are folks that make up to 138% of the federal poverty line. So how much is that? For a single person, this is someone who makes $1,800 a month. For a family of four, it's someone who makes $2,483 a month. Many of these people are also on SNAP benefits, which are also being cut, which gives them $7 a month, basically, to supplement their food. Many of these people are struggling to pay their rent or their mortgage if they're lucky enough to live in a house. So think about the average monthly cost of some of the things that you pay. The average utility bill is over $100. You have your average rent, food, groceries prices are going up. Ground beef right now is $6. So think about, you now have to choose. You're losing your SNAP benefits. Even if you're able to stay on Medicaid, you have to choose between, am I going to go get a primary care exam and pay a $35 copay? Or am I going to use that $35 to pay my electric bill? Am I going to use that $35 to feed my family? These are the decisions that people are already making even when they're on health insurance. And they're going to forego that preventative care visit. They're going to put it off until they physically can't put it off anymore. Then it's going to be a whole lot more expensive if it can be treated at all. So, and what's particularly frustrating is employers don't have to provide health insurance to anybody that works less than 30 hours a week. There are a lot of employers that intentionally will hire people for 29 hours a week. There are a lot of people who are working 2 jobs, but they can't get health insurance because they don't work the hours to get it from either employer. Or you have people like someone who spoke on our first press conference who works construction, hurt his back, so he can't get a job in construction. And he's tried to find another job. But he's worried about, how am I going to afford my care if I have to prove, while I'm trying to treat my injury, that I'm working when I can't get a job because of my injury. And so what my colleagues on the other side of the aisle in the committee said was, we're just trying to strengthen the system so that it's around for everybody. But nothing that this bill does addresses the root causes of the cost of care. All it does is say, we're going to put more barriers in the way to the people that need it the most. And oh, by the way, those same people, we're going to make it harder for you to get food. When we go back to Washington on September 2nd, we're in the middle of a budget fight for the next fiscal year, which starts at midnight on October 1st, where they're talking about cutting rental assistance and housing assistance. It's the same population of people. And the Trump administration and the Republican majority came into office saying, we are going to focus on lowering people's costs. But most of what they have done since, and especially with these cuts, is raise everybody's costs. And when I go across the Commonwealth, whether I'm talking to Democrats, Republicans, independents, rural, suburban, urban, they all say, I want to know that if I get sick, I can get access to care without going bankrupt. I want to be sure that I have a chance for my children to have a better shot than I did, and I want to live in safe and healthy communities. That is what Congress should be focusing our attention on right now, not making it harder for people to get those things.
Thank you so much, Congresswoman. And then the last thing I want to do before I open it up to questions from press is, I think some of you in here may know Regina Sayers. I know she encouraged folks to come out today. Regina's she's still considers herself a Tazewell community member, but moved to North Carolina in order to get specialized care for her husband who has dementia. And so she asked me if I could read these remarks on her behalf today. Hello, everyone. Thank you for the opportunity to provide remarks for today's press conference. I would have been with you today if it were not for the impacts of underinvestment in rural communities. Tazewell is my home, even if I no longer physically live there. But 6 months ago, I had to make the incredibly difficult decision to move to North Carolina in order to have access to specialized care for my husband, who has dementia and other chronic illnesses. I had the means and opportunity to move to a metropolitan area and did. However, if Tazewell had offered the care my husband needed, I would have gladly stayed here, as I love this community and the life we had built here. I still come back often to visit and try to stay involved in civic life there. But Tazewell residents have witnessed a decline in health services over the years, from neurology to endocrinology, memory care to oncology, and even OB/GYN services. Some of my friends and neighbors have to travel for hours to receive the care they need. As the former CEO and executive director of the Appalachian Agency for Senior Citizens, I've seen firsthand how fragile our rural healthcare infrastructure is and how deeply programs like Medicare and Medicaid support it. Rural America is already hurting. Every year, more and more rural Americans are forced to either travel long distances or leave their homes and relocate to cities because of healthcare cuts. The $1 trillion cut to Medicaid will only make things worse, yet our community's congressman said these cuts would, quote, end up being minimal. However, having to uproot our entire lives because of a lack of investment in rural healthcare is not minimal. Placing our local hospital at risk of closure is not minimal, and kicking over 300,000 Virginians off their health insurance because of cuts to Medicaid and the Affordable Care Act is not minimal. And that's why I'm calling on Congress to please stand up for Tazewell and undo these disastrous cuts immediately. Thank you. And so that's on behalf of Regina. Yes, thank you, Regina. And I just wanted to go ahead and see if any reporters in the room had any questions for the panel. And if not, I think if folks are available to do one-on-ones or to chat with audience members, if you have time to stay, we would certainly welcome that. And again, I just want to thank everybody for coming out here today and encourage you to contact your member of Congress. Thank you.